Have you noticed that there's something off or unusual about your cat? Or maybe you just want to be really proactive with their health. Either way, you are in the right place. In today's video, we'll explore the common signs of kidney disease in cats, how to recognize them early, and why prompt action is so important. Cats are absolutely amazing at hiding their illnesses, so knowing exactly what to watch for is incredibly important. It can really make all the difference in the world. So let's dive in. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. First, let's understand what kidney disease is. The kidneys play a crucial part in body health. They filter toxins from the blood, maintain fluid balance, and regulate essential nutrients. When the kidneys can no longer do these jobs effectively, cats develop a condition labeled chronic kidney disease. Unfortunately, chronic kidney disease can't be reversed, but it can be managed with the right care if it is caught early. Let's go over 5 very common signs to watch for. One of the most common signs of kidney disease is an increased thirst and urination. Now, this is kind of like the chicken and the egg theory in that some people notice the chicken and some people notice the egg, but either way, it's a big clinical sign. If your cat seems glued to their water bowl or you find yourself just filling the dish more often, that's a big red flag. It's not necessarily something specific to kidney disease, but it's definitely a red flag. We may be talking about kidney disease, diabetes, hyperthyroidism, GI disease, the list goes on. If your cat has had a change in behavior and how much they're drinking, it's a red flag. You may also notice more frequent urination or more clumps in the litter box or bigger clumps in the litter box if you use a clumping litter. This happens because the kidneys are no longer concentrating the urine. They're not effectively pulling excess water from the urine back into the body. So that water that would normally be saved is being lost in the urine. And of course, you're seeing it in the litter box. Another common clinical sign is loss of appetite and weight loss. Cats with kidney disease can oftentimes feel nauseous, so they'll avoid eating. They may approach their bowl, sniff it, and walk away. They may act like they want to eat, but as soon as they get a whiff of the food, they walk away. It can be a very frustrating clinical symptom and disease process. Over time, if your cat's not eating enough, that's going to lead to weight loss. You may notice it first as muscle loss or thinning around the spine and the hips, but after that muscle loss starts, usually we get the weight loss as well. If your once hungry cat is suddenly picky or finicky or just doesn't want to eat, take note. That's a red flag. Another common sign is vomiting. Now, this doesn't always happen, but cats that are nauseous will commonly vomit. With kidney disease, this can happen because of those buildup of toxins in the bloodstream. That buildup of toxin makes the cat nauseous, and if the nausea gets bad enough, many cats will vomit. If they're not vomiting, you may see just dry retching or dry heaving, drooling, or as I previously said, just avoiding food altogether. Sometimes this nausea and vomiting even leads to bad breath with kind of a chemical or an ammonia-like smell. Now again, vomiting isn't specific to kidney disease. Lots of things can cause cats to vomit, but it is definitely one associated with kidney disease and you should be on the lookout for it. A fourth clinical sign is lethargy and weakness. Essentially, your cat just becomes really lazy and tired and they're laying around more than they normally would. They may avoid playing. They may sleep in abnormal locations or positions. They may seem less interested in their surroundings, and they may actually be trying to avoid you as well. This fatigue or tiredness can be a complication of the nausea, of the vomiting, of the weight loss. It can also be a clinical sign of anemia, which can also happen with chronic kidney disease. And then the fifth clinical sign to watch for is poor coat condition. If your cat's fur seems dull, rough, greasy, or you're visually noticing that they are grooming less frequently, this is oftentimes a sign of illness in cats. A healthy cat usually has a sleek, shiny coat. And even though this is a subtle clue, it's definitely a clue that something is going wrong. All too often, we chalk this kind of thing, sleeping more or not grooming as much, up to them getting old. And that is a very, very slippery slope you have to be careful not to go down. Cats, by nature, are incredibly fastidious, and they want to sleep in their normal positions. They want to follow their normal routine. They want to groom themselves. When these things aren't happening, those are all very subtle clues that something is going wrong. So to recap, The 5 signs you want to look for are increased thirst and urination, loss of appetite and or weight loss, vomiting and or nausea, lethargy or tiredness and weakness, and a poor coat condition. I had also mentioned, kind of as a bonus, that bad breath. Bad breath can definitely be an indicator of kidney disease, as well as dental disease, but it is something that should be looked into either way. If you're noticing any of these signs, please don't panic, but don't ignore them either. The first step is to schedule a visit with your veterinarian. They'll take your cat's weight, perform a thorough physical exam, and oftentimes run blood work, urine samples, and hopefully a blood pressure. With chronic kidney disease, early detection is absolute key. If we can catch it in the early stages, it gives your cat a better chance at management and maintaining quality of life over a longer period of time. If a diagnosis of chronic kidney disease is made, then creating a management plan is the next step. And it's that management plan that will change based on your cat, your disease process, and where everything is at. But it's that management plan that usually includes the food changes, the medications, the supplements, the things that are designed to support your cat and their kidney health. So I know kidney disease can feel overwhelming, but remember, you are not alone. Many cat caretakers, including myself, have successfully managed chronic kidney disease and given their cats a happy, comfortable life. Stay observant, take action when needed, and lean on your veterinarian or a veterinarian you trust for guidance. If you found this video helpful, please like and subscribe for more tips for your senior cat. If your cat has been recently diagnosed with chronic kidney disease, check the link below this video for a sign up for my free class after the diagnosis, Caring for Your Cat with Kidney Disease. That's coming up in a few days. Thanks for watching, and give your cat an extra cuddle today.